Thank you, Will. That was very well put, the description of what we all need to do to prevent the spread of this. First of all, we know, it is obvious that the community is very concerned about this new swine virus, the swine flu virus. We share that concern, but we're not overly worried. So far, all of the cases in the United States have behaved just like regular flu. No more aggressive, making people no more ill than you would expect from a regular flu virus. And in fact, that was the case with the individual we're going to be discussing today. We are taking aggressive measures like we're about to describe because this is a new virus. And until we've learned enough about it and are certain that we know enough about it, we will do what we need to do to limit its spread, to slow its spread in the community until hopefully at some point we'll be comfortable enough that it is, in fact, behaving just like seasonal flu, and then we can lower our guard and not have to be as aggressive as we are taking steps today. The individual who was first confirmed to have swine flu virus in Maricopa County and in Arizona is an elementary school student who attends Moon Mountain School in the Washington School District. In consultation with Washington School District and the school, and in keeping with the CDC guidelines, we are going to dismiss this school for 7 days and hopefully then be able to reopen the school. I want to explain the rationale for that 7-day period. We know enough about this virus to know that if somebody has been exposed, they will develop symptoms within 7 days. By dismissing the school for that time period, asking people to monitor their children's health during that week, and asking them not to let their kids come back to school if they develop symptoms, we think we can then safely reopen the school without reintroducing the virus to the student population. And again, although we have no reason at this point to worry that this new virus will cause severe illness in our population, we're doing this just in case until we learn more. The child that was confirmed was in fact sick before any of us, or most of us, had even heard of this swine flu virus. The child became ill early last week, went to the doctor, was diagnosed with flu, and as part of that, a lab sample was taken. When we learned later that week, the end of last week, about this epidemic, the state cast a very broad net looking for cases of flu and went back to some of those existing samples that had already been taken and sent them on for confirmation to the CDC. So in fact, this virus was here before this became a concern in the community. I'm certain this isn't going to be the last case. We're looking very hard for more cases. We'll probably have several more cases shortly. It is behaving like the flu, after all, and flu tends to get around the community pretty efficiently. So hopefully we will soon learn enough from the epidemiology in Mexico and elsewhere and be able to say, yep, this thing looks just like the flu. Our disease control measures are going to be just like they are every year, year in and year out for the flu. And again, the most important thing is going to be the hand washing and covering your cough and keeping your hands away from your face that was just described and is truly effective. I also want to say that if you have influenza-like illness, you don't need to run to the doctor unless you're having severe enough symptoms that you would have gone to the doctor before all of this news happened. we don't need to treat everybody with mild illness with antiviral medication. Again, in this case, this child recovered and was back at school before we ever got this, this laboratory result.